I'll just like to talk to you a little bit about how we use imaging for breast health. The main medical imaging procedures that we use for the breast, the first one is the mammogram. We're probably all familiar with that. What it is it's an x-ray. It uses very low x-ray dose, much lower than any other imaging test that we do. And this is what the mammogram machine looks like. You stand and your breast kind of lays on this plate, which is the image receptor, and the x-ray comes out from here, and then this clear plate is what we call the compression plate. So that's like what squishes the breast, the dreaded compression, right? Everybody hates that. But we don't do it just to be mean. It actually is very necessary. But what are we doing with the mammogram? We're trying to detect signs of cancer. As Dr. Lewis touched on, we can do mammograms as a screening test or a diagnostic test. Very, very similar, but very different. The screening test is a yearly test. It's done for healthy women with no breast problems, no symptoms of breast cancer, no reason to think there's anything wrong. We're just screening. And so then when you get called for that, if you get called back for the diagnostic mammogram, we're usually looking to answer a specific question. So actually, you may come for the diagnostic mammogram because we saw something on a screen, or if you have a symptom like a lump or nipple discharge or something like that, then you should have a diagnostic mammogram. And when the real difference in the two is that the screening, you come in, get your pictures, and leave, and they're read later. The diagnostic, when you come in, the doctor will look at the images right then, decide what other images we need, maybe do an ultrasound, maybe recommend something else, but at the end of that appointment, the question should be answered. You know what needs to be done next. And so I'll just show you a couple examples of why we do diagnostic mammograms and ultrasounds. So this patient had a palpable lump. So she felt a lump in her breast. This is the MLO side-to-side view, and we see this mass. So that's where we use the ultrasound, and what the ultrasound shows is that this mass, it looks black on the inside, and then has this brightness behind it. That's what fluid looks like. So we know that that's just a fluid-filled cyst. It's not anything that's going to hurt her. Here's another example. This lady did not feel a palpable lump. She had a screening mammogram that showed a small mass. See that? It was about probably a little bit less than a centimeter in size. And so she came back, and then it was identified with ultrasound. And what we see on the ultrasound is this little dark mass. So we know that's a solid mass. And it has these very kind of irregular borders, and that's what a cancer looks like. A non-cancerous mass usually has smooth borders, and a cancerous mass has very irregular borders. There have been some advances in breast imaging. Digital mammograms became available in 2000, but really just most widely adopted probably in about the last 5 to 7 years, and that's because there was a large trial done that showed that digital mammography was better in women with dense breasts. Another big advent that's being much more used is called the breast MRI test. It's like a big magnet. The table kind of slides in, and the breasts kind of hang down in this little hole, and the pictures are taken like that in the kind of face down position. And what it does is it gives us that 3D picture of the breast, okay, instead of the 2D flat picture, in very high detail. And that helps us identify cancers that are not visible on the mammogram.